Welcome to the deep dive. Okay, so it's Tuesday, June 24, 2025, and something pretty big just landed in Chennai. It's sending ripples right across India. We're talking about a new pharmaceutical. People are calling it a weight loss wonder drug. Honestly, the buzz feels more intense than a Bollywood premiere. So what we're diving into today is this once-a-week injection. It promises to help with India's, well, frankly, growing obesity crisis, and remarkably, maybe even cut heart risks. But the big questions are obvious, right? Is this the miracle solution everyone hopes for? Or is there, more to it? What did your deep dive uncover about the promises and maybe the pitfalls?
That's exactly what we set out to explore. We've sifted through a ton of information around this launch. And our goal isn't just listing facts. We really want to connect the dots for you. Look at the science, sure, but also the economics, the culture, the frankly intense competition that's heating up in India's health sector. By the end, you should have a really solid grasp of what this means for India and maybe even beyond.
Okay, let's unpack this then. First off, to really get why this drug's arrival is such a big deal, we need to understand the scale of the challenge. India, famous for its amazing food, vibrant curries, sweet jalebis, but it's now facing this health issue that's anything but sweet, a serious escalating obesity epidemic. The numbers we found are pretty stark. We're talking over 254 million people classified as overweight or obese. And wait, there's more. Another 351 million have what they call abdominal obesity. So that's roughly, 24% of adults carrying significant extra weight?
Yeah, it's staggering. It puts India third globally for overweight individuals. It's a profound shift.
It's not just about appearances, right?
Not at all. Obesity is basically a gateway. We're talking over 200 different diseases. Think diabetes, heart conditions, certain cancers. It's like inviting a whole host of health problems into your body. It's a systemic drain, really, on people's health, productivity, the healthcare system.
And the economy, too, I imagine.
Absolutely. The economic cost is just monumental. Projections suggest obesity-related illnesses could cost India something like 1.57% of its GDP by 2030. That's billions of rupees. Money that could be going into, national development, infrastructure, education. It really shows how critical this is on a national level.
What's really concerning, though, is that it's starting young. We saw research. Kids as young as 8 are dealing with this.
That's right. It's alarming. About 8.4% of kids that age are classified as obese and another 12.4% overweight. This isn't just an adult issue. It's affecting the next generation.
And how does that interact with, say, cultural views? Does that play a role?
It does, and it adds another layer of complexity.
Right.
We learned that in some parts of Indian culture, having a bit of extra weight, this sort of prosperity padding, can sometimes be seen as a sign of wealth, of well-being.
Okay.
So that makes it tougher, right, to convince people that obesity isn't just a status symbol, but a chronic disease, a serious medical condition that needs management. It's a big hurdle.
Okay, so with that backdrop, a serious health challenge, cultural complexities, it's clear why people are looking for solutions. Which brings us back to this new arrival, Wegovy. What is it exactly?
Right. So Wegovy isn't a new yoga pose or anything. It's a once-weekly injection. The key ingredient is a molecule called semaglutide.
Semaglutide, okay.
Yeah. And the science is pretty neat, actually. Semaglutide basically mimics a natural hormone called GLP-1. Think of GLP-1 as a signal messenger in your body. It talks to your brain's appetite center, tells it you're feeling full, reduces hunger signals. It also slows down stomach emptying so you feel satisfied for longer after eating.
Makes sense. Less raiding the fridge later.
Exactly. Plus, it has this bonus effect of helping regulate blood sugar levels, which is obviously huge in a country like India with high diabetes rates.
And the results, we heard they were impressive.
Yeah.
The clinical trial showed people losing around 15% of their body weight on average, which is significant. And for some, like 1 in 3 people, it was even up to 20%. That's like losing a small suitcase full of ladoos.
Yeah, it's a substantial amount.
Yeah.
But here's something else really crucial. It's not just about the weight loss. Studies also showed it cuts the risk of major cardiovascular events, think heart attacks, strokes, by 20%. That's in people who already have heart disease and obesity.
Wow, so it tackles weight and heart risk.
Precisely. It's a powerful dual action.
And this isn't just hype from abroad, right? India's own drug regulator approved it. Yes, the Drug Controller General of India, the DCGI, gave it the green light back in February 2025. And that was after trials involving over 3,000 Indian patients specifically. So it's been vetted for the local population. Seems pretty solid. Okay, now let's talk about the timing, because this launch seems rushed. Novo Nordisk originally planned for 2026, but suddenly it's here mid-2025. What happened?
Well, the short answer is competition. They definitely didn't want to be left behind. Their main rival, Eli Lilly, launched its own weight loss drug, Mounjaro, in India back in March 2025.
Ah, Mounjaro, right.
Exactly. So Novo Nordisk basically hit the fast-forward button. It's a high-stakes race for India's huge obesity market. Getting there first, or at least not too late, matters a lot.
And they have big ambitions, I hear. Something like $1 billion in sales within 5-7 years.
That's the word on the street, yeah.
That.
Highly ambitious. And their strategy reflects that. They're not just shipping boxes of pens. They're building obesity clinics, training doctors all over the country, partnering with state governments on awareness programs. It's a whole ecosystem approach.
And they're importing it all from Denmark. Must be running those factories flat out.
Pretty much, yeah. Factories running 247 to meet global demand. It's a massive logistical operation, like churning out pens faster than a street vendor flicks parathas almost.
Okay, let's get to the elephant in the room, the price tag. Wegovy comes in those pre-filled pens, 5 doses. How much does it actually cost someone in India?
Right. So the first 3 doses, that's the 0.25 milligram, 0.5 milligrams, and 1 milligram, they're priced the same. 17,345 per month. That breaks down to about 4,366 for each weekly shot.
Okay, 17,000 rupees a month for the starting doses.
Yeah. Then the higher maintenance doses climb. The 1.7 milligram is 24,280 a month, and the top 2.4 milligram dose is 26,050 monthly.
So we're talking roughly $50 up to $300 a month, depending on the dose. How does that compare to Mounjaro, the competitor?
Mounjaro is actually priced a bit lower, somewhere between 14,000 and 17,500 a month.
So cheaper, but there's a catch.
Well, kind of. Mounjaro usually comes in vials. You typically need to go to a clinic or have a healthcare professional inject it. Wegovy's big selling point is the pre-filled pen. You can use it yourself at home. Convenience factor.
The convenience is definitely appealing. But still, those prices in India's market, which is known for being very price sensitive, I mean, a monthly grocery bill for a family could be less than 1 shot. How does that work for widespread access?
That is the critical question. Novo Nordisk's India head calls the pricing smart and innovation-based. They point to pricing the first 3 doses the same as a way to ease patients in. But yeah, affordability for the masses, that remains a huge challenge. It really makes you, the listener, think, doesn't it? How much is that convenience worth versus the raw cost?
It feels like we're watching a proper Bollywood showdown in the pharma world now. Wegovy versus Mounjaro. You mentioned Mounjaro targets GLP-1 and another hormone, GIP.
That's right. And because it targets 2 pathways, global trials showed slightly better weight loss results, on average up to 20% versus Wegovy's 15%.
Is that slight edge enough to make a big difference? Mounjaro did get a head start, launching back in March.
It definitely gave them an early advantage. They apparently racked up 24 crore. That's about $3 million in sales in just their first 3 months. That's not insignificant.
But Novo Nordisk must be confident. What are they leaning on?
They're banking on a few things. First, their long history and reputation in diabetes and obesity care in India, decades of it. Second, that user-friendly pen we talked about.
And didn't you say Wegovy was tested on Indian patients, unlike Mounjaro?
Correct. Mounjaro relied mostly on global data for its Indian approval. Wegovy has that local trial data, which could build more trust with doctors and patients here.
Plus, they have this underlying brand loyalty.
Huge brand loyalty. Their India CEO basically said, every second insulin patient in India uses our stuff. That kind of existing trust is incredibly hard to compete with. It's like, sticking with your trusted old barber.
Okay, so it's a real battle, but then there's this plot twist coming. The patent.
Ah, yes, the patent plot twist. Semaglutide's main patent in India expires in March 2026. This is around the corner, really.
And that means?
Generic versions. Potentially lots of them, which could drastically cut the price and make these kinds of drugs accessible to way more people, really democratize it.
So what's Novo Nordisk doing about that? Just waiting?
Not quite. They've actually secured a court stay from the Delhi High Court to block any premature generic launches before the patent actually expires. Their reasoning is patient safety.
Interesting. Protecting their market, but citing safety.
Exactly. But publicly, they say they welcome competition. They argue obesity is such a massive problem, no single company can solve it alone. It's a nuanced position, balancing business and public health narratives.
Right. Okay, so we've talked benefits, competition, cost. But let's be real. This isn't a magic wand, is it? There are side effects.
Definitely not magic. Common side effects are things like nausea, sometimes vomiting or diarrhea. General digestive upset, basically, especially when starting or increasing the dose.
That sounds manageable for many, but are there bigger concerns? You sometimes hear whispers about other issues with new drugs.
Well, there have been some questions raised in studies globally, potential links to thyroid issues, maybe eye complications in diabetics, but Novo Nordisk is firm. They say no causal link has been proven in their massive trials involving over 60,000 people. They also address muscle loss, saying it's pretty normal when you lose a significant amount of weight, regardless of how you lose it.
Okay, but what about the skeptics? We've heard some doctors worry about the yo-yo effect. You stop the drug, the weight comes back.
That's a valid concern raised. The argument is that these drugs manage obesity as a chronic condition. They don't cure it. So if you stop the management tool, the underlying condition can cause weight regain.
And others just argue it's overhyped, that lifestyle is still king.
Yes, you hear that too. That maybe these are seen as quick fixes, distracting from the hard work of changing diet and exercise habits, which many still see as the fundamental solution.
So where does that leave us? How do we see the bigger picture here?
Well, zooming out, India's obesity situation is undeniably serious. It's like a public health tsunami driven by urbanization, readily available junk food, less active lifestyles. It's changing the country. And remember, obesity isn't just about weight. It's linked to diabetes, heart disease, even depression. It's a national challenge. Novo Nordisk seems to be trying to shift the whole conversation, pushing for obesity to be treated seriously as a chronic disease, not some kind of moral failing, training doctors, setting up clinics. It's a big push to change perception.
So wrapping this up, what does it all mean for India, for someone listening?
It's complex, isn't it? Wegovy is clearly a significant development. Solid science, impressive results, that added heart benefit is huge, game-changing potential for sure, but the high price is a major hurdle in India. Then you have the generics waiting in the wings, and those deep-seated cultural views on weight. It makes Wegovy's journey in India really unique.
So the future depends heavily on affordability. Yeah, if that can be solved maybe through insurance, government help, maybe those generics really taking off in 2026, then Wegovy could become a really important tool in a much bigger effort to improve public health.
Absolutely. We've seen today how just one drug launch can shine a light on so much. A nation's health crisis, its economic pressures, its cultural nuances. As Wegovy settles into the Indian market, it really makes us think beyond just the science of losing weight. It pushes us to consider the bigger societal changes needed for genuine well-being.
Indeed. Which makes you wonder, what other innovations or maybe what completely different public health strategies will really be needed to turn the tide in India's health story? What stands out most to you from everything we've discussed today?